to you. I'm Rashad Milligan. So nice to see you guys again. I hope it come on in. Come on in. I know it's a bit early. I started 6 o'clock on the dot Eastern time, but we have a very, very special guest, Helen, all the way from Chicago, now down in Miami. The 305, we have Dr. Shastri. Doc, how are you feeling today?
I'm feeling great. So good.
Amazing, amazing, amazing. Now, I guess we could just get right into it. You work with a lot of cosmetic surgeries and things of that nature. Just what all in detail do you do on a day-to-day basis?
So, I have my own little med spa here in Brickell, which is in Miami. I specialize in injectables, so things like Botox, Dysport, any neurotoxin. And I also do a lot of filler, any kind of filler. And so I treat all portions of the face, everything. I do Sculptra. I do a lot of regenerative medicine things like plasma treatments, which is actually one of my favorite treatments because it's regenerative, it's natural. We're using your own blood and taking the good parts of it and putting it back into wherever it needs to be injected. And so I do a lot of that. And the last thing I do is Morpheus 8, which is radio frequency microneedling, also regenerative. So
Okay, okay. All right. Well, you listed a lot of things there. I guess just asking, like, those years of study to even just understand everything that you just said right there, because it was a lot.
it was a lot.
Just I guess a background of education. Where'd you get educated and things like that, and what did you learn at each level?
Yeah, so originally from Chicago, as you mentioned, so I did all of my schooling there. I'm actually an internal medicine physician, so I did my med school at Chicago Medical School. I did my residency at Mount Sinai in the North Chicago VA. And so I was practicing primary care, but right out of residency, I got trained in aesthetics. And so that was sort of always my passion, and it was on the side for a few years until I moved to Miami and I stopped practicing internal medicine and just fully focus on aesthetics now. So I'm constantly, with anything, you need to keep training and keep learning and keep educating yourself. And there's new advances in this field all the time. So I'm constantly doing that.
Right. And speaking of aesthetics, I guess, like, just what do you think is the largest misconception about work in that field?
So with aesthetics, I know, it's kind of the wild, wild west. And a lot of, I guess the biggest concern of my patients when they come see me is I don't want to look overfilled, or I don't want to look done, and I don't want to look like people on TV, like, like certain people on TV, etc. So, with that, I think the trend, hopefully my trend and my aesthetic is natural. I'll never want to make people look different than they look, totally different, but I just want to enhance and refresh. And so I think that is the biggest concern I'll get from a lot of patients these days. So we're trending in a different direction.
Right. No, 100%. I want to ask you, building off of that, what do you think that does for someone's confidence to have that kind of enhanced features and everything that they might have been insecure about before?
Oh, it is. So it's one of the most rewarding parts of treating people is how happy they are, which is different than internal medicine for sure. And so, some of it is instant gratification. So if I use filler on you, you're going to see that instantly, and you're going to see the change instantly. And so, when they look in the mirror and they see the little tweaks and little changes I have made, and it makes, such a big difference, even if I don't do so much and it's natural and they just look less tired and more refreshed. It just, confidence is what I do.
I know that's a nice way to put it. Confidence is what you do. I want to ask, kind of even building off of that, about confidence is what you do and the fillers and stuff. Have you ever had, or what do you do? I just assumed that you've had it happen to you before, but what do you do when a patient is coming up and they're like, I want this and I want this and I want this and I want this to look like this, and you're like, hold on now, that this is a lot. I like to keep things as natural as possible. If we do it, you're gonna look like, so and so ABC on ABC Modern Family, so just how do you kind of deal with those situations?
So, it's our job as medical professionals to always, give you guys our medical opinion, right? And so for me, when I feel like somebody is wanting too much or is wanting unnecessary things, it's my job to pump the brakes there and be like, you know what, this is not the time. And if they want a lot of things at one time, which can be done, it's just my personal method to do things in a stepwise manner. So I would do maybe one or two things on this visit, have them come back in a few weeks, a month or two, and then maybe revisit what they want to do next.
Right. Okay. And with wellness, on the wellness side of things, as a doctor in your profession, do you ever give just like basic kind of wellness tips of like, hey, yeah, I mean, I can do this for you, but you still need to get more sleep. I can do this for you, but I still recommend, taking a walk outside every day, get some fresh air, get some sunlight. Do you still kind of recommend those things, I guess, under your line of work?
Yeah, they kind of coexist because beauty and wellness definitely are integrated. And so you can do all the things and I can inject all the things, but if you're not, you're right, taking care of yourself, doing the preventative care, using your SPF and all the things that you need to use, drinking water, all of those things, you're not going to get your optimal result. So all of those things definitely go hand in hand. And so I'm always shooting out my ancillary advice, whether they listen or not.
Do you ever feel, I guess, like kind of like a more psychologist or anything like that sometimes when you're like, hey man, I love you, yeah, I appreciate all the business you give me, but you got to learn this a little bit about yourself more. You got to do these things. Do you ever feel like that, kind of that role sometimes?
Oh, yes, for sure. I mean, when my patients come in here, it's just like lively and bubbly anyway. So I hear all the gossip and I hear all the fun things that are happening. But we definitely touch on that because body dysmorphia, especially here, I think in Miami versus Chicago, is a lot. Body perception and body awareness is very different. And I think body dysmorphia is a real issue when people start really nitpicking at little things. I always have them take a step back, we look at the big picture and kind of, quiet it that way.
Okay, so speaking about body dysmorphia, but even like on the positive side, like you said, like for a lot of times people come in, they're bubbly and stuff like that. I guess, and you did talk about you are a confidence builder and stuff like that. But what is, I guess, other than those things that you previously mentioned, the most favorite part of your job?
The most favorite part, I think the most favorite part is when a patient is just so happy at the end of our visit and they see the mirror and they're just so excited. They've been wanting to do a little lip enhancement forever, but they've been scared and they don't want to have duck lips and this and that. And all their worries when they see the mirror melt away. They're so happy. And I think that's truly the most gratifying part of this is just seeing people genuinely happy and confident.
What's the biggest trend or the biggest kind of request that you get from women in 2023?
My biggest probably request, which is the hardest area to treat, is the under eyes. I think a lot of people come in here, a lot of moms, no sleep, new babies, all the things that are happening, stress levels, everything. The under eyes are kind of the biggest concern, I would say, out of a lot of the women that I see, a lot of patients I see, even men.
And I guess, like just what are the things that both men and women can do, I guess, to coincide with that work, with going to see you to kind of help those things under your eyes?
Yeah, under the eye. So, it's tough. There's a few options you have for treatments. You could use filler. But my preference again is going back to that regenerative natural treatment, the plasma treatment. It is so great for under eyes because it's such a tricky area. Even the most experienced person injecting with filler, you can just end up with lumps and bumps and it takes a certain candidate for filler. So that's why I prefer plasma. It really helps with that hyperpigmentation, which is the dark circles, the fine lines and wrinkles, the hollowness. And then of course, in conjunction which is hard to do. Get enough sleep, get enough rest, take those stress levels down. Whatever you can do externally to help would be great.
I know that this might not be like your exact lane or anything, but speaking of taking the stress levels down, how does one, I guess, exactly do that?
Oh my gosh, getting stress levels down. Well, I can speak from my experience, and for me, I think exercise is what really does it for me. Because I have two little boys and they're nuts and like and they're always everywhere and ready to go. So, stress is always crazy. But for me, exercise is where I clear my mind. I get my body moving. I feel great afterwards, no matter how hard it is during. I just push through it, and it's physical and it's mental, and it really gets you there. The other thing, I just kind of personal journey started recently doing is not looking at my phone right when I wake up. I put some music on, or like a gentle meditation or positive affirmations or whatever it is, anything to start your day off positively instead of scrolling and just going straight into the stress.
100%. Who are some affirmations people that you like to shout out, if you have anybody in particular you like to shout out to?
I don't know. I honestly YouTube it, and I just YouTube positive affirmations, and whatever I'm feeling feels in sync for that day. That's the one that I go with. So I don't know, but I'm open to recommendations if anybody has
Oh,
them.
Louise Hay.
Okay, I'm
Louise
gonna check.
Hay. She'll get you right. Shout
She'll
out to
get
Louise.
you right. It's so.
She died in like 2017, and she was like 90, maybe 92 or something. And on the tapes these are tapes from like the 90s and 2000s. She's talking about, I see myself living well into my 90s, and she's just speaking everything into existence. She had once had cancer. She had cancer, and then just through affirmations and changing the diet, of course, and stuff like that, the cancer was gone. So she's
Amazing.
definitely powerful. One of Oprah's people too. So Louise Hay, shout out to her.
Amazing.
Yes.
I'm gonna
Uh, I
definitely.
I do want to ask. I guess we're at that kind of point now about you. So you're in Miami. You're in South Florida. That community of cosmetic surgery, they're kind of they were in the news in the past couple of months. I just want to know from you, from your standpoint, how is the community kind of how did they kind of grieve that entire thing? And like, what do you do in those moments? Do you like, send a text, you send an email and like, hey, keep your head up, everything's all right? And do you go back to your people and you're like, hey, make sure we got our P's and Q's right? How does that go?
Yeah, I mean, so so I don't do cosmetic surgery per se, right? So but I do, with what I do, can have adverse effects that can definitely be detrimental to somebody's face and skin and sight and all sorts of things. So I think the biggest thing is education. Keep educating myself. I know exactly what to do if there is an adverse event, so I can prevent any serious complications. And I've been trained in it, and I just, every person I see, I think about the stuff that I've done during the day, and I wonder, and it's just in me to worry about people's safety, and patient safety is always number one for me. So I never, do anything that's going to put any patient at risk. And, of course, with injectables, with cosmetic surgery, with anything, there are risks that you are taking while you are getting, this elective service. But knowing that the person that you're, kind of in, who you're putting your faith in, knows how to handle that, I think is the biggest thing to research. Just make sure that you're going to somebody who knows and, is very educated on it.
Okay. All right. And so you're speaking on that education, everything like that. I guess that leads me into my next question. For the young Black and brown girls watching this live right now or watching the replay, what is your advice to them if they want to get into the medical field, or field of cosmetics and wellness and all these things that you're doing right now?
So it's not an easy road by any means. You need to be focused and stay on your goal always. And, just make sure that you are studying and doing, just doing your absolute best. There's a lot of avenues to get into like this field of aesthetics, depending on what you want to do. You don't need to be a physician to do it. So you could be a nurse practitioner, dentist. So there's other medical professions that you can do to get into the avenue of aesthetics. So that's also something to think about too. I just didn't know that, I always knew I wanted to be a physician for whatever reason, but I didn't know that aesthetics was my calling until I got trained in it. And I knew that that's what I was passionate about. But if you know it early, there's a lot of avenues. And so the other thing that I do is I teach aesthetics. I actually train medical professionals to get certified in injectables. Excuse me. And so, that's also part of the gratification that, I'm giving somebody this knowledge.
Okay, and speaking of that, with your classes and with your courses and your career and education and preaching the importance of education, I want to give you a chance to shout out where people can, connect with you and, take some of these courses, learn from you one-on-one and get that, I guess, personal experience firsthand.
Yes, so I do offer some online courses as well as hands-on training privately. You can find that information on my website, www.drmiamimd.com. And so there's a whole aesthetic academy there, and you can click on that. The other way to get in touch with me, if you want, direct training or hands-on training, one-on-one, or even just if you have questions, it takes me a few days, but I'll get back to you, I promise. I'm really easily accessible via Instagram. And so my Instagram is at made, MADE, in Miami.md. And so there you can always DM me any questions, any thoughts. I always get back to everybody who messages me.
Okay, all right. Well, we appreciate that so much. Is there anything else that you have coming up that you want the people to know about or give the people a heads up about?
We're just planning a few events here in the local Miami area. I'm actually located in the Icon Brickell, so we'll be doing something here. And then, just to stay, if you follow me on Instagram, you'll get posted on all the events and all the deals and all the things that I have to offer.
Okay, all right, sounds good. Well, you guys heard it here first. Hold on now. I'm gonna quiz myself on live. I'm gonna quiz myself. Madeinmiami.md.
Madeinmiami.md. Yep, that's my Instagram. Yep.
There it is. And she'll get back to you. It might take a few days, but she will get back to everybody. She said that she's passionate about that. Anyone who wants education or to know what's going on, or you have questions about this or that I didn't get to tonight, there you have it. And we appreciate it so much, Doc, for stopping by Health IQ for this week. Thank you guys. And as always, please take care of yourselves. Thanks, Doc.
Thank you so